Adishima Maya sign Emma Munina Makwaba Bim and ne World Prematurity Day. We are seeing now and a Saturday at the SO and on an so Ghana Health Service and so as ye Omutana Sinomaki come of rain in album number from Akomako best 11,000 and a summary ye woo more brana or more dano crampo and so into me and so ye Nesenti. Konfanochi abaya sabia de eka ho miam ya hodo bebre eno munyina ka ho ane ye ni wiase nyina eka bom edi saade na Ghana Health Service Director wadano eye Dr. Emmanuel Kojo Tenkran wono ene nya bre echeche kwan a samofra no ye faso ye wo mo ne ye kase preterm baby kura na sei ne siche Dr. Charles yesi edichwe
prenatal care. We want every woman to attend antenatal care and be provided with quality antenatal care in most of our healthcare facilities. For instance, pregnancy-induced hypertension can only be detected at the antenatal clinic. If we don't detect it, at a point in time, you will get what we call eclampsia, where you will start convulsing. And then when you get to the hospital, the most important thing a doctor can do to save you is to do cesarean section, whether the child is matured or not. And that will contribute to what? A prematurity. See? So if we're able to address some of these things, prematurity will be averted. And then we come to family planning, as I've said. Our family planning coverage in this country is very low. But the focus of maternal health is that of family planning. You can only improve your health as a mother when you adopt family planning. Every country that has succeeded in this world has used family planning as the key. And what is prematurity? It's very simple. When the child is born too soon, because it's expected that we say 9 months. But more appropriate is 37 weeks. The child should be in the womb for 37 weeks before it comes out. If it comes out before the 37 weeks, then we say it's prematurity. Usually in Ghana, you are viable when you are 28 weeks in the womb. That means that you have a chance of survival. So from 28 weeks to about 36 weeks gestation, we term it prematurity. And that's what we are talking about today. There are several causes of prematurity. But basically, maternal health is the key. Because if there's a problem with a pregnant woman, then definitely it may lead to either stillbirth or what? Prematurity. So you can't disaggregate the two. Maternal health and child health are always linked. So the prenatal care, we call it antenatal care, is the key if you really want to reduce prematurity. So you need quality antenatal care so we can assess the pregnant woman better and know the complications. For instance, if there is diabetes, hypertension.
Dr. Tenkran Science nya daji echeche kwan ye befa so be hwe sa mo franketinkiti ya yawo mo no esansa bo so menkono ni nuru ansa na yawo mo no empen bebre na be hu mo no na o ma ye nketenketi bi wade hye de ne kwahye nkubetam bi oso ade friend kangaroo madaka no wode ne betoto obum saa na wusi ne o makra na o hye obo ni nyina mu no panyini nya daji echeche kwan ye befa so a ye bebo mo ho ban na ma mo nso so anhwe o mo nkwa.
We want every woman to attend antenatal care and be provided with quality antenatal care in most of our healthcare facilities. For instance, pregnancy-induced hypertension can only be detected at the antenatal clinic. If we don't detect it, at a point in time, you will get what we call eclampsia, where you will start convulsing. And then when you get to the hospital, the most important thing a doctor can do to save you is to do cesarean section, whether the child is matured or not. And that will contribute to what? A prematurity. See? So if we're able to address some of these things, prematurity will be averted. And then we come to family planning, as I've said. Our family planning coverage in this country is very low. But the focus of maternal health is that of family planning. You can only improve your health as a mother when you adopt family planning. Every country that has succeeded in this world has used family planning as the key intervention to improve. Our coverage as a country is very low, 30% as a country. And even when you go to some regions, there's about 20%. See? We can't develop as a country with this low coverage. So there's a need to talk about family planning as a people. And then we come to the prematurity itself. When it happens, what can we do? The health system should be able to address prematurity. Said that if a child
Yeda so awa sansem kro na mu na Asante mantem hanom coordinator foforo kra ye no Directorate fosu yebo a wono so ekire se kwan e befa so a betumi aboa amofrei ye friend kangaroo madaka ne se wode ne hye woyam na ohyewe ne bi atumi aka no eno akire no wosan so my statistics kakra e de fasa preterm babies
region we had over 13,000 newborns being delivered too soon in 2015, and in 2016 there were 12,700 newborns which were delivered too soon. Currently, as we speak, in this year we have over 11,000 newborns delivered too soon. And the issue about prematurity is that when we take all our under 5 deaths as a country, about 60% of them is due to prematurity and its complication. So if we want to reduce our under 5 deaths, then as a country we must focus on our preterm so that that contributing factor of 60% can be reduced. And one of the key things that is needed when it comes to reducing deaths that are associated with prematurity is kangaroo mother care. It is said that in low-income countries and middle-income countries like ours, when a child is born before 28 completed weeks, 90% of these children would die, as opposed to less than 10% of these babies when they are delivered in high-income countries. And surprisingly, for the high-income countries, one of the key things that they've been able to do.
Yemfri sansemu na yento aso e wonsem foforo mu mam Ghana nyina ebekaya obra Ghana mampanyin na nadodanko akufo ado wobo nto ano woka se mensini ahodo ni bi wo hono ma ya na emu sosopa ne senti se Ghana for the tumi ni hye ne nsa wobechiche mu kakra ama mpuntu obia nsoso akoso e wo meame ahodo bebre eno na nam so masa na ejumadi no etumi abaso a ya checheche saa nkronkro ne mensini mu kakra se de be ya mpuntu obia beba no ebi nso betumi akọ ahodo nyinamu na osoafo a ono ehwe ye nkurase mpuntu so eye Hajia Alima Mahama wono ene ka ho bi pa wodi mu akotene e ma se ne MMDA fo yetumi chiche omu nyina eko awiye na kane no na MMDA fo no na omoye mako 216 na ene nyame yadoma chiche mu bebre no omaye 254 enti se na ne diso no ekoye ahafo ano South West District Assembly wo ho ahafo ano South East District Assembly, Amansia South District Assembly, Amansia West District Assembly, Achimanwa Bieja District Assembly, no so ho, Adanse South District Assembly, Akrofom District Assembly, any bebre na ekeka ho na wabra ye ne Hajia Alima Mahama wono eyo soafo hwe nkurase mpuntu so etwetwe nkomo no sei na wo cheche nsemu de kire
criteria that we've adopted us. the areas that we have identified as other new municipals or district assemblies are already constituencies. We have not created any district that will necessitate the creation of a constituency. The president has the mandate to create districts, municipalities, metropolitans, and the Electoral Commission creates constituencies. But the law is that you cannot have one constituency divided into 2 districts. So if we do that, it means that other area must be established as a constituency. So we have not done that. We have followed the existing constituencies. So districts that have 2 or more constituencies, some constituencies have been turned into districts, have been made districts, so that it will still be districts and still. For example, my constituency is Nalergo Gambaga. It's 1 district, 1 constituency. It's my precinct district. And the district is 162,000. It could have been divided into 2, but it is 1 constituency. 1 constituency, 1 district. So until a constituency is created out of it, I cannot divide it into district. So, for example, East Mamprose, much as I would like to see it.
Intina we HSMensini banko ma konbese aduasa enwoche na Ghana man panyin na nado dan kwakufu ado watumi ate e de ababeka kane de wono 216 ho ti wukane mia eboma na ewo 254 na Samri abeka ho mo nyina so ebetumi nya mpuntu no omo so chefa ye free sansemu na yakọ vice president Ghana man panyin abedi eche Dr. Mahmoud Bawumia Samri wotumi ebo aprosa na pro na wobo no ni nyina ne se Ghana man panyin dada na abedi eche Dr. Alihu Mahama omampanyin kofo na bedi achwe na Samri otoye bese mfiem akomako enum ni ne no nanam so na omoye amamre ne amane se omodidi sa na finhia na e de amano no ohonom na mpanyimfo eche se Zongo support unit fund bi Zongo Development Fund yade ananka esi papa ya wanya ne krechi kwa ni so pa ni nyina ne se ya na Ghana fo bebre na wadwene se Zongo fo ne de ye tan omo Zongo fo de MPP fo MP o masem eno nam so ma papa yi eka kire o mampanyini dada akofo se wonhwe ne wonfa fund bi foto bi ento wo se de eno nam so na ebetumi aboa ma sa Zongo fo yi omo so benya omo chefa mpen bebre no beko omaso ye na echese how bebre ewo omaso ye sanitation abeye problem ahunidie ho nsem omunya baabi na suku kurampo omunya baabi kurampo no makọ we na opanyini chese akoye ha kese pa e de amano ne senti wo srese Ghana mampanyin na nado dan kwakufu ado abaidie na eno na obesre pa se onhwe na sa fund na na se foto na esi o mampanyin dada akofo na bedi achire ani so no wonhwe na omasa adwumadi no entumi emra so ma no ne senti omutumi eye se foto yi botaya esi achi anase botaya da so ne se eba beboa ema Zongofo a omososo etete miamia hodo no omososo etumi enya omo chefa na Alihu Mahama ni so ade hu na esi na ni so no ni nyina so etumi abaso sa papa ye beka ne yepa obehu ni bia na nanim sede na chese amamuo no na odimu akotini yepa ne senti eni so ade hu na esi na ni so a nyame amfa ye a anase nyame kura fa ye a opanyini eko ne krechi na wo se mpanyimfo hwe na omoye na ono so ba bi owo bia na ne kra so eni tumiji.
I remember one of the conversations we had about the Zongo community, and he said, you know, the MPP as a party has a lot of work to do in the Zongos. But he said that we have to continue. He says, don't give up on the Zongos, because you have to continue to show that you care about the Zongos. In fact, I'll tell this story today. The story of the Zongo Development Fund started with Alhaji Aliyu Mahama. We were talking, and he said, we have to do things to let the Zongo appreciate that the MPP is not anti-Zongo, as the propaganda was at the time. He said, what can we do? And we started talking about specific interventions because government after government after government had not paid attention to the zone. So this is why when we brought that suggestion to His Excellency Nana Addo Dankwa Akufo-Addo, he immediately said, that is a good idea. Let us put it in the manifesto.
Ghana mampanyi abedi achire de sansem we nyina to udwa wo bra na ye kai o mampanyi dada abedi achire Aliu Mahama okọ ne kreachi na mo ye esom abompaye ede ama no eno panyi de sansem we nyina to udwa se Botaya Zongo Development Fund no e baba ye ne se e bebo adehye otiti we na wo zongo so na se sika betumi abo mo na oha buburo ne ohia buburo na ya na mpan bebre adokro mo no ene adwene bi ya na nkrofo bebre wo e wo mo se NPP fo de wo mo tan nkrofo a wo zongo no enye no kre ho na Ghana mampanyina bedi achiri e de sansem we nyina etu udwa ye to ansem no so na ye de amamo abusuafo me nyina we so na ye na ye homra ye ba de aka achiri ne de beto aso.